For weeks, DCH COVID-19 inpatient numbers across the system were below 10. In the last week, those numbers have dramatically jumped. As of this morning, we were at 65 COVID positive patients within our health system. These increases are consistent with what other areas are seeing across the country, especially areas with low vaccination rates. Many have asked if this is due to the Delta variant of the virus. While that variant appears to be more contagious, the vaccines appear to be effective against it. How do we know this? Most of those who need inpatient care for COVID were not vaccinated. Recently, the Alabama Department of Public Health shared that unvaccinated people represented 96.2% of COVID-19 related deaths in Alabama since April 1st. The Alabama Hospital Association shared the results of a hospital survey in which 94% of COVID-19 positive inpatients had not been vaccinated. The CDC has now also started collecting data on this. On July 16th, CDC Director Dr. Rochelle Walensky indicated that 99.5% of recent U.S. deaths from COVID-19 were of unvaccinated people, and 97% of current COVID hospitalizations are of unvaccinated people. COVID-19 vaccines are keeping people from getting critically ill. They are working. Tuscaloosa's rate of individuals being fully vaccinated for COVID-19 is just below 31%. DCH's current employee percentage of fully vaccinated staff is 53%. We're all falling short in the fight against COVID-19, yet the strain on our healthcare system and community is largely avoidable. When you couple the low vaccination rates that we have with the ongoing nationwide nursing shortage that we are experiencing, it becomes quite concerning. For many months during the pandemic, DCH has had access to federal funding to bring in travel nurses to help fill the vacancies. That funding came with a time limit and has been used up. With low vaccination rates, DCH is seeing the number of patients with COVID requiring hospitalization increasing daily. We are quickly approaching a very difficult situation and need help from the community. We are doing everything we can, but we need the community's help more than ever. First and foremost, we need the community to get vaccinated. Vaccines are the best course to reduce and defeat COVID, and the most effective way to make that happen is one-on-one conversations with family and friends. Please reach out to those that you know that have not been vaccinated and talk to them and encourage them to do so. For the second request, we need more direct help. As I mentioned, we are seeing a spike in the COVID-19 virus and need additional nursing help in many areas. We are asking registered nurses and licensed practical nurses in the community to come work with us. With this in mind, today we are making available a program that will offer community RNs short-term work arrangements where they can work a few shifts as their schedule permits. Under this program, they would receive an hourly rate plus an incentive payment for the time completed. Our full-time employees are being offered a similar incentive for any additional shifts they may pick up. DCH needs your help today. Yeah, I'm extremely proud of our staff. They continue to rise up to meet the mission of our organization. They are constantly reminded of the fact of why they got into this business in the first place, and that's to take care of other people. But they're frustrated. You know, it's challenging because this is so largely avoidable by taking the vaccine. Yeah, our need is to provide the best care possible for our patients, and we need staff to be able to do that. That's why we're asking today that if someone has an active RN license or is an LPN, please come and contact us and come to work and help our patients and help our community.